Hello, everyone. Welcome to the first episode of Problem Solved, Fixing Last Mile Engagement in Healthcare. Today's episode is our first one, and I'm so excited to have our first guest, someone who needs no introduction in the STARS world, in the Medicare world, Rex Wallace. Welcome, Rex.
Hey, Shub, thanks for having me. Congrats on the new podcast. Super happy for you, excited for you guys. We've been working together for a few years now, right? And share some clients, and now we share a producer. So shout out to Stefan, our common podcast producer here. So, but yeah, seriously, congrats, and excited to be the first guest.
Thank you, and this is great. We've as we've worked together, and as you've seen in the industry, there's so much change going on, and there's so many challenges. So really, where do we start with engagement? Well, you've let me turn it over to you and say this year seems a little different than last year, than the other years. How are you handling it? How are you seeing it?
Yeah, it is. I mean, from us, if we just kind of stay in the stars world, right? Medicare Advantage in general, it's a crazy year. I mean, I've been doing this a long time. I've been doing stars since 2012, right? So since it kind of became meaningful, it's hard every year. It's a little different, especially recently, right? Since probably, I don't know, 2019, 2020 with COVID and all the different changes that have happened. But this year, yeah, it does feel way different. I mean, we have a new administration, if you haven't heard, who sees things differently than the last one. We have new. It's almost like a comic book world, right? With some of the people nominated for some of these HHS and CMS positions. We had Dr. Oz's confirmation hearing in the Senate on Friday, and watched that, and was I think. But the way I'd answer your question, though, I think the main point here is the uncertainty, right? Like stars leaders. If I'm a stars leader, I'm facing more uncertainty now than I think I ever have, and we've said that the last 2 or 3 years, but it's definitely true this year. So we have a new administration. We don't know exactly what's going to happen, exactly how they, we kind of know how they see things, but we don't know exactly how Dr. Oz is going to lead CMS, or even how RFK Jr. is going to lead HHS. So a lot of uncertainty with the new administration. Lots of financial pressure on all these Medicare Advantage plans, as you and I have talked about before. That's making it harder for stars too. I mean, it's graded on a curve. We got to keep ahead of the competition. It's hard to do that when we're with limited funds, right? So stars leaders are facing uncertainty from the new administration, all the changes. They have fewer dollars in their wallet to sort of improve stars. Then they have all these lawsuits that have happened. We have upwards of 15 lawsuits that have happened in the last 12 or so months. Big lawsuits that have already resulted in some big changes, but potentially can change the STARS program itself with a couple of these lawsuits in particular. So yeah, it's there's a lot going on, and there's a lot of uncertainty, fewer dollars. It's hard. It's hard to know, and I didn't even mention the changing weights of caps, right? So which caps was heavy weighted, then it declined. Now it's like the math problem is entirely different this year than it was last year to get to 4 stars. So, this new administration may change those weights again. So it's this constant kind of, if you're not evolving and innovating and adapting, you're left behind.
Right. It's true. In technology, there's this thing called being agile. As they develop software, it feels like you need that agility, not just in how you view it, but also how you react.
It does, yeah. For sure. Yeah, I think adapting is absolutely the key right now.
So, in addition to the stars changes, new administration that we've seen, we've also had a very, very unusual AEP. As you know, the economics are very different in the planned world. And there were, what was that, like almost 1.8 million people had to choose new plans because Medicare Advantage plans left markets, merged contracts, so they were not in certain markets. And as a result, There's a lot of a lot of change, a lot of new people trying new plans. How does that dynamic impact stars and quality for stars leaders and their teams?
Yeah, in general, new members are not good for stars, right? It takes time to sort of get them engaged, typically, right? Some plans are obviously better than others, but and I've been saying, and a lot of people are probably saying for a while now, for the last several months, that I think the most, and I really believe this, the most important thing a Medicare Advantage plan will do in 2025 is do a better job of understanding their members, especially those new members. So, and a lot of these new members, you could say they're maybe not unwanted, but they were not being gone after, right? Like a lot of these
Right.
plans didn't want to grow this year, and some of these plans actually made efforts to prevent growth, right? They lowered commissions and blacked out their marketing in certain markets just so they wouldn't grow because their financial pressures are so steep right now. But when you have, like you said, a couple of million members whose plan left the market or left a county, those members have to go somewhere. So, sort of want it or not, these members join plans that we're not necessarily looking to grow, but they have them now, and those members will undoubtedly impact their star ratings in probably a negative way, without some serious interventions in understanding them. So, and this is where, I know this is what you guys do, and I know this is not a commercial for Predict Health, but, as we're kind of talking about important things to do in 2025, yeah, I mean, understanding your members through things like, building advisory committees or focus groups or surveys, or digging into your data, your big data, right, and just understanding those members is I think inarguably one of the most important things plans will do this year, and leveraging that data to improve stars, to improve the components of stars like HEI, like understanding those disabled and low income populations and dual populations, in a better way. And I know we'll probably talk more about those advisory committees, which you and I have partnered on several health plans, right? And that's been a great experience for our firm to be in the weeds and to set those up and actually help facilitate them and collect that feedback and help plans improve. And that's a tremendous opportunity this year.
Right. It's true. It's almost par for the course. You really have to understand your members right away, because you can't wait years, months on end before you learn from the normal course of business, because that really puts you at a disadvantage. In fact, that's one of the barriers that we see repeatedly. But you've seen, as you work with plans, several dozen plans now, across the years, different markets, both on stars improvement, quality improvement, also in health equity. What are some of the common challenges that you see stars leaders and their teams face? Hindrances, things that just limit their growth, and let's pick one and sort of break it down. How has they solved it? What's your experience for that?
Yeah, it's hard to pick one because there are. I mean, because I was gonna say, do you want the whole list or just the top 10, right? Because it's like, um,
So let's go with the top five.
but I'll take one. And my engagements, our engagements, they start out with a comprehensive assessment typically, so we really understand. We look at all the data and we interview, sometimes up to 30 leaders across the company to really understand what do they think the barriers are, right?
Right.
And without anyone else in the room, if it's just me and this cross-functional leader, hey, what's holding you back? And some have a better grasp than others, but I think it frequently points to organizational engagement, and I think we can pull the thread all the way through and see how that can have a tremendous impact on member experience, right? And an example I think of is, and it's somebody that we both know, a friend of both of ours, but Blake Amos from Cigna, right? So I remember I was doing a podcast on our podcast one time, and we had two guests. We had Archie Day from Scan Health, and we had Blake Amos from Cigna. And I remember we were talking about governance. We were talking about customer experience and retention, and at that point, retention was a big issue. It still is a big issue, obviously, for Medicare Advantage plans. But where does the retention team sit? So from an org structure, organizational engagement standpoint, even where does a department like that sit? Does it sit under growth? Does it sit under customer experience? Does it sit right under the Medicare Advantage plan leader or wherever? And we were talking to Blake about this, and Blake said, it depends on where your organization is from a maturity perspective, right? So sort of are you in a place where you're trying to rapidly grow? Are you young? Or just in another space where you're trying to rapidly expand across states? Versus, are you a very stable population and looking to just hold on to your members? In a lot of places in between on the spectrum. But I think it points to the fact that every organization's different, right? I mean, there's a I forget if is it a Zen saying or something, but you'll or maybe a Stoic one, but you will never enter the same river twice, right? You'll never step foot in the same river twice because it changes every second. It's a different river. Different things go in and come out, and it's all different. I think our organizations are like that, and understanding where our organizations are, and did we just did we have a surprisingly big AEP and we just all of a sudden have 17,000 new members that we didn't expect, and we're busting at the seams, and there's obviously a huge revenue potential there, but we could those are the most vulnerable members, the ones who, from a retention perspective, right, and an experience perspective, and even a CAPS perspective, they don't get the CAPS survey their first year, but that first year is when when expectations are set, and is your organization managing up to those expectations? So where I'm going is governance and having, like, in that case, a retention or a customer experience or a member experience committee or work group or task force that kind of owns that, or even an executive steering committee that owns that and helps influence the direction of your whole organization as it approaches member experience. But it depends on where you are. We, our highest performing clients are constantly evolving, not the org structure necessarily, but their governance committees, and changing them as they evolve, right? And even like one year they may have a customer experience committee that covers customer experience and retention and everything else, but the next year they have a retention issue and they know they need to be laser focused on retention, so they have a retention committee all by itself, right? That's completely focused on that. So I'm a big believer in governance and organizational engagement. So
yeah, and you've led organizations doing that. So let's dig into that a little bit. So how do organizations determine, and when should they determine? Take for now, for example, which committees should be formed, and how does that align with the priorities? So help organizations, stars leaders who are thinking through the same problem. What should they do?
Yeah, I think you can say every year, and maybe even more frequently, but any time it's needed, right? There needs to be, so with one client, I'll use an example, a real world example, right, where the client was struggling with their engagement, their sort of engagement across measure owners and just across the organization with people who not only own, but just the people that influence all of these stars measures, right? And they had, I don't know, a dozen committees or work groups, right? They called them work groups, I think. So we actually had a 2-day summit where pretty much all we talked about was that, right? So it was the quality leadership. It wasn't necessarily all the measure owners in the meeting, but it was the quality leadership team where we walked through, this is our governance structure now. We have all these work groups, this is their focus. And some would be focused on, like, maybe there's a CAPS and HOS work group, right? That's a hell of a lot of measures, right? I mean, that's 9, 10, 11, that's 14 measures, right? In one work group. It's just too many. So, as we worked, collaboratively on this and looked at where do we need the most focus? So, and they were struggling with, let's say, access to care. So we decided let's have one group work on getting needed care, getting appointments and care quickly, and maybe getting needed prescription drugs. But purely focused on access. How do we fix that? Because if you fix access, that fixes a lot, right? I mean, it's hard to close a HEDIS gap or refill your medication if you don't have access to a doctor or a pharmacy. So if you are not going, or if you don't have access, you know you're not going to close those other gaps. So, um, but what we did was we went so deep as to even think through: do we should we call each of these a work group, a task force, a committee, something else? There was an overarching steering committee, but then really thinking through each group, what is the energy that people are going to feel if you're in a task force versus a committee. If you're in a committee, maybe you think, you're not really taking action. You're
Right,
just kind of
right,
discussing something, right? Maybe making decisions, but not necessarily executing. A task force felt more execution focused, but maybe not high, but maybe felt too low in the hierarchy or something.
right,
So we put a lot of thought into that, and their specific organization. Like, how does it need to be worded? What's going to resonate the most? Do we call measure owners measure owners? Do we call them measure champions, measure stewards? Like, we had several options that we really debated on. If I'm a measure owner, does that make me feel complete, like, single throat to choke accountability?
right.
And maybe that's not what this organization needs right now. Maybe this organization, needs more supportive roles. And it just kind of, again, it depends on where you are as an organization. So it was a fantastic exercise that I would encourage every health plan to go through. But I mean, I think it's an every year thing, right? Every year you need to think through, where are we now? What's most
Right.
important for us this year? And do we need new work groups, new task forces? Do we need to change them up? And I think changing them up is important because it just kind of keeps things fresh.
Right. And what you're saying is right on. Is not just the committee or the task force. It's how do you empower them, and how do you empower them both directly, like the language you use, champion, owner, but also adjust that along the way, because what may be a planning, more strategic in year one or the beginning of the year one, maybe more operational. How do you bring that in? And I've seen you, as you guys have led some of these task forces, really bring that together. It's once it sings, it's an opera. It's really great.
It's so important too. I
Yeah,
think anyone who overlooks the importance of of a governance structure, right? And I don't even love the word governance. It's more of like an engagement structure,
right,
right? I think we talk a lot about member engagement, provider engagement. There is, I think, arguably the most important piece of all of it, of STARS, which is a matrix program. It's not like all these people report to the STARS team or the quality team,
right,
right? It's all dotted line influence. I mean, it's like, if you can't influence, then you're not going to be a very good STARS leader or STARS team. So it's all about engaging
yeah.
those other
And the key
parts.
thing, and I've seen you do this, a key thing in those meetings, the strategy session, is really having the input from all the parties. So you talked about the provider, you talked about the member, you talked about the stakeholders. How do you ensure that? Because that could be, that can also be a challenge, because you may be working with less information. How do you ensure that you power people with the right information, with the truth, so that they can act on it? How do you see, your examples?
Yeah, it's so important too, and I think I would argue even up to the steering committee and the C-suite, right? If we're not, whether it's a dashboard or some other vehicle to keep the most important, key performance indicators, but there needs to be, some of the most powerful decks I've seen, and I've seen you do this, when you're after doing some advisory committees, right, or some focus groups, and having all this rich voice of the member feedback, putting actual blurbs on a slide, right? The key is to not drown them in data. So, like, you could easily have slide after slide of tables full of member quotes, but the key is to pick maybe the six or nine most important ones and put them really big on a slide in bubbles or something, right? Where this is what our members are feeling. Um, you know, I've I had a client one time who did these focus groups. They were having a really bad time with retention. They had their CAP scores were very low, and they were trying to build urgency. And so they captured all this voice of the member feedback, and then we did this um, listening party, right, where we had a big conference room at their home office and invited all the executives in and watched some snippets from some of the videos of some of the focus groups like you guys do, right? And actually hearing members say it verbally. And this client had popcorn. It was like going to the movies, right? So popcorn and cokes and even candy. And then we watched all these videos and digested it, and made some hard decisions about, we don't want our members saying that. We don't, we want our members to feel better about their experience with us, because it was a lot of hard stuff to see. But yeah, that voice of the member feedback, like that you guys capture from these meetings, it's so rich too, right? I mean, I can imagine, we have a lot of clients who just dig into grievance data or complaints data, right? Which is so valuable by itself, but it's different. And I've talked about this before. It's different, me asking you to fill out a survey, or you filing a grievance and me reading kind of what you said when you filed that, versus me sitting on across the table from you, or even across the screen from you in a virtual advisory committee or focus group, and asking you that same question and you giving the same answer, and then us being able to discuss it and go 7 levels deeper in my understanding of your response than just me capturing your response on
Right.
on a grievance form, or even listening to a recorded phone call where you voiced something but the customer service rep maybe didn't have time or didn't take time to dig into it, right? But for me to really understand the context of your response and more depth around it, it's so important when I'm shaping my benefits strategy or my outreach strategy.
Right. It's true. It's capturing feedback, if it's done once in a while, you don't build what we've seen some companies do very well, and it pays off. Is a culture of feedback, a culture of conversation with your members. One of the companies that we've seen, and this is one of the best meetings that I've ever been to, was where the CEO joined the meeting. It was an advisory group. They were having members were there. There were obviously some of the stars leaders in the meeting, quiet listening in, and it was an active conversation. And the CEO walked in, and he stayed for the entire meeting, and it was the level of engagement, the conversations that he introduced himself, and it was amazing. People were crying, and this was a level of reached a different stage and a level of sharing about positives, negatives, everything about the program, the offerings, and it was so meaningful. And it was I think the leadership were talking about being one of their best meetings they've had that year, and it was and it really changed how they viewed the feedback coming in and how they're using it as a result as well. It's you ask the right questions, or you ask questions, and you're able to go deeper. First time beyond surveys, because when we hide, surveys are helpful and they're useful and effective, but they only give you one level of insight. And you really want to dig in deeper, especially on these hard, challenging issues that you're facing, especially now in today's market.
Yeah,
Uh,
some of the most meaningful meetings that I've been in the last 3 or 4 years, right, are in those advisory committees with your team, right? Um, where we had, a common client, and we had whatever, 10, 15 Medicare Advantage members in the room or even on screens, right? And you guys, you've proven to me that you can effectively have a hybrid meeting, right?
right.
Where you have people in the room and have people, members at home who can't travel, but they have devices, and you facilitated this way to interact with all of them in an effective way to capture their feedback and make them feel listened to. And because if you only have the meeting with people who can come physically to the room, it's not a representative sample, right? I learned
Right.
that from
Right.
you. You know, so in these advisory committees were forced on us by CMS, but wow, they have they've become so important. I mean, I wish every health plan did them and not just SNP plans, right?
Right.
That are required to. But yeah, but seriously, some of the most impactful meetings I've been in were, in a meeting with 10, 15 members who were listening to them. I was listening to them. I was asking them questions. You guys were asking them questions, and hearing their actual responses and their stories. I mean, it moves you in a way that nothing else will, right? In our industry, if we don't have, I mean, especially with the populations that we serve, if we don't have empathy, I mean, what do we have?
Right.
And it's such an important way to keep being empathetic, right? Is to be in front of these members who are facing these challenges as members of our health plans, and it gives us a level of understanding that we'll never get anywhere else.
Right. I want to change gears a little bit and talk about innovation. So, as you see plans today, as they are taking through the next few years, new administration, where do you see a lot of the innovation happening? What's being tested? What's being tried? And what is your experience of things that are emerging?
Yeah, and I define innovation as anything that a health plan, if we stick with stars, right? Anything a health plan wasn't doing yesterday that they start doing today, that that is expected to positively impact their performance, right? So it's not. I think a lot of people think of innovation as a NASA command center or
New
something like that.
technology, AI.
Yeah, yeah. And I don't know. I don't like if those things are out there and they're making a big impact. I don't know what they are. So in my mind, innovation is, if we kind of stay in the member engagement, member experience space, right? I think you know like we have some clients who are doing this, right? Who are doing these, who have launched these advisory committees when they don't have to. They're not required to. They're not a SNP plan, but they've seen the impact maybe their SNP division has with these, as far as collecting actual voice of the member feedback and then leveraging that. I think also just I see plans trying harder and harder to do new things to orchestrate their outreach strategy. Right, it's such a pain point. It's such a driver of churn and dissatisfaction, where members feel like their time is not being valued because
Right.
we worked with a client one time who, a member complained because they'd gotten 8 different outreaches in the same day, from the health plan, right? From vendors. So maybe, an in-home assessment and a billing rep and a customer service rep with some kind of outreach and another care gap and who knows what else, but 8 different outreaches from different teams, internal, external. So, working to orchestrate that more effectively to make sure every person, every entity calling that health plan's member had the same message, the same authentication method, right? So one's not calling for a date of birth and one's calling for your home address and one's calling for a social security number, like, because you never, members are, there's so much scam too, right? So anything innovative to orchestrate that. And then, I think leveraging that data is so important, and in a place that I think most health plans would say they're drowning in data, but not orchestrating that or synthesizing in a way that makes it actionable, right? So I think putting a lot of focus on that and making their data actionable, going deeper and deeper and deeper, building cohorts of members, understanding not just, Medicare Advantage plan members are not all the same, right? They
Right.
range from 18 to over 100, right? Building actionable cohorts and really understanding those members and then treating them separately based on their specific characteristics. Those are, some people would not say those things are innovative, but every health plan is not doing that. And the ones that start doing that see an impact immediately, right?
That's great, and we see that as a need across the board. It's such a overwhelming challenge. Does it vary by size of plant? Because there's always we're a large national plant with multiple markets versus a small one. Have you seen plants vary the level of at least tempting or testing of different ideas or change, as you said, by size?
Somewhat. I think if we're talking just purely like innovation, I do think that the big nationals, Humana, United, you know, plans like that, I do see them having more of a focus on innovation.
Right.
They're more willing to pilot things than many small plans. I think many small plans just don't think they can, right? And um, I think where the difference is, I think the biggest differences between small plans and large plans is sort of how they manage stars. Large plans, and they both have pros and cons, right? I'm not saying either one is super easy and one super hard. The the nationals have more, obviously, more people to communicate with and more scale to operate on and across markets, across states, a more sometimes decentralized structure. But the plus, number one, they have a lot of scale with providers typically, which makes all this easier, I think. And number two, they're they're more likely to have departments and people who are solely dedicated to them and focused on maybe Medicare Advantage. If I'm a small plan, I have fewer people to communicate with and engage with maybe, but all of those people, many of those people are shared services, and they have priorities across my Medicare Advantage book, but also the Medicaid book and the commercial book and ACA maybe, right? They're juggling multiple responsibilities, wearing multiple hats. It's very difficult too, and those plans typically don't have scale across providers or other entities. So there are pluses and minuses both. But I think any plan can innovate. I think we do have some, and I wouldn't call them small, but more regional plans of, let's say, 100, 200,000 members who are doing really good things from an innovative standpoint. And I would even argue that changing your governance structure every
Right.
year. One of our highest performing plans is, let's say, 150,000 members, and we work with some nationals too, but this is probably our highest performing overall plan. They look at their org structure or their governance structure every year and change it, right?
Uh-huh.
Depending upon what they need. I think that's very innovative and something that most plans are not doing.
And that's accessible to everybody, regardless of size. So right there,
Right. Right.
that's an innovation that you can try.
Right.
Great.
Definitely.
Um, so thank you so much. This has been really insightful. As we wrap up the podcast, I have one question for you. What's the one thing you'd like to leave listeners with as you think about your advice to stars leaders and stars teams today?
Um, I think so. Here we are we're in mid March, right? So I'm a big reader, and a couple of books I started the year off with this year were "Stillness is the Key" by Ryan Holiday and "Grit" by Angela Duckworth,
Oh yes.
and they both left big marks on me. And I think if I'm a stars leader leading a matrix program, I think a lot of people don't take time to isolate and be still. And I think, you know, go off into the wilderness for a couple of days, right? Like metaphorically, right? And be alone and think and strategize, and then come back and be ready to evangelize, like, influence. It's all about influence, right? So get in the right headspace, get really clear on your strategy and roadmap, and then go focus hard on engaging the right people, building trust across your organization, across your membership, across providers, um, and then teach your organization to execute. I mean, that's a lot, but if you can do that, good things happen.
All right. Great advice. With that, thank you so much, Rex, for joining us today and kicking off the podcast, Problem Solved. So excited. So with that, let's wrap up, and we hope to see you all for the next episode. Thank you all.
Thanks so much, Shub.